like this, folded back like this. Then you could take it like this. So it really depends on how your company has folded them. So you're always going to check your table for water, put it in the center, let it unfold, and then you get to pick left or right. You don't have to do just the left or do the right. You can decide, and you're going to come from here and pinch this to unfold it. You're not going to come from here because this is going to end up sterile. So you're going to unfold and unfold again. Now be careful when you go to the other side that you don't do something like that, right? Keep this arm at your side, it's like dead. Now I'm going to unfold this. And now if there's two people, this works really nice because you can grab the ends, and don't grab up in here because remember, we're sterile on the tabletop. So grab down here and open it. And there you have it. So that's opening a table drape as an unsterile person. So this drape will be folded the same way. The drape will be folded the same way. If you were going to put it on as a sterile person, you could have taken this drape off your pack and gone over to your other table and draped that out. We haven't learned the process for that yet. We're going to learn that in an upcoming drape.
Here's one. Are you taking?
Yeah, let's do it.
Yeah, just as a test.
All right.
We'll see how it looks.
We'll
I'll
see
put it
how
on
comes out of
YouTube,
this.
private.
I better get all duded up here then.
I folded that one, so if you want to fold that one after, see if I did it right.
Okay. All right. Now, you know, you're going to have two options. Your option is going to be to use, and I should grab this here, a once open, which is sealed on both ends, 2-ply, open in the middle. So you can use a once open, or you could use 2-ply. You want to use the same size, right? Most hospitals now use the once open, but you're going to find really that the stuff that comes from the manufacturers, there's an outer cover that's usually an envelope style, and you open it up and the product inside, like a gown or a drape, will be folded in a blue Kimberly-Clark in the envelope style. So we're going to do the envelope style of wrapping, and the first and most important always is to make sure that your product is clean. You would never want to put something in here that isn't clean. And we know that if we were going to wrap this bowl or potty, and if we were going to choose the method of steam, this could not be plastic. It would have to be metal. And let's do that. Do we have a metal bowl up there?
Here's one. You want this
That's
one?
okay. We get an amethyst basin. Let's do an amethyst basin. Oops, sorry. Okay, so we got an amethyst basin. It's clean. We're going to pick the appropriate size wrapper. This looks pretty good to me. And I always put it at a diamond shape. Put it in the center, and now you have to choose the appropriate indicator strip. And because we are deciding to use the method of steam, which is the most economical method, quickest, fastest, I guess that'd be the same thing, quick and fast, and cheapest, we're going to use an indicator that says steam. So you want to make sure, even if it says steam, that it's not turned. Obviously you want one that hasn't gone through the process. So we're going to put that just right in the center there. Kind of center this, don't have it over here or way over here, center it. Come over the product and you want to completely cover it. And I just fold a lip back. Then this is just something that I do. I sort of like pinch it in here and bring it up. And I like to get a nice kind of a point there. Tuck that in, pull it back, and bring this around. Now what you don't want to do is go all the way around the product, because if you do, when you go to try to open it, there will be nothing to grab because it's been tucked all the way around. So you want to leave this so that there's something to grab. And if you want to accordion pleat it a little, you can do that. It doesn't matter. Now I'm going to take my second wrapper, and I'm just repeating the same process. Completely cover the product, come back, sides, folding this side. And now we've got kind of a lot here, right? So you probably are gonna have to roll it a little bit and then bring this up. Now, we need to put indicator tape, and we're gonna put the same kind of tape for the method we're using, so steam. So we'll put a piece of steam indicator tape across here, and we will then label the product where?
On the
Tongue blade
On
or
the
tape.
or a tongue blade. We could label on a tongue blade too. And so then, we've got it labeled, and it's gonna go in the steam autoclave. When it comes out, if we were gonna open this, we would want to make sure that our tape has turned. We wanna make sure that there are no holes or tears. We would feel for any water or moisture, which is called the strike through. Look for any stains. Sometimes it has that yellow stain, like if you had water coming in your ceiling and there's a yellow stain, you think, oh, the roof is leaking. So we would look for stains, and then any like dirt or grease or anything. And now we're gonna open it. And you'll get, so that you'll know when you work in surgery, that this really is probably the smallest size wrapper that we have. And so when we wrap something that's really kind of small in a wrapper, you sometimes have to let it unfold a little to open it. So we have checked all those things, and there's one more thing that we should check. What should it be?
The strip.
Expiration date. The strip is in the inside, but the expiration date. And where are we gonna find that?
Julian sticker.
Right, on the Julianne sticker. But now, if our hospital employs indefinite shelf life, then we know that we won't find an expiration date on the Julianne sticker. However, we will find information such as the load number and the autoclave if we found that there was a problem with our sterilization process, then we could go and track other items that were sterilized. So once we have checked that, we're gonna say that our hospital employs the indefinite shelf life, so we don't have an expiration date. And so how do we know that our hospital employs an indefinite shelf life? Their policies. They will have a policy that will say that. Okay, so once we've checked all that, now I can unwrap it. And I know that it's been wrapped a few times, so I'm gonna let it roll a little bit. And I'm gonna get it to this, I call this a starting point. I stick my thumb in, and I'm going to tuck. And now Kimberly-Clark wrappers tend to have memory. They open up on you. That's okay. So it did a little bit of my work for me. Because the left one opened first, I'm gonna hold the product in my right hand, pull this around and tuck it. And now I might tilt it a little and find the furthest corner, pull this around and tilt it and pull this back. Now, I have a couple of options. I can hand this to a sterile person. What is an issue with that? Anybody?
If it's contaminated, then the sterile person's contaminated. There's a hole in that you can't see.
Right. Okay, number one would be, if I hand this to a sterile person, we really don't know if it's sterile yet because we can't see the indicator. It's wrapped up. Right. If we had a hole in the outside wrapper, we would not be able to hand it to a sterile person because that would mean the outside to the inside wrapper is contaminated, right? So then that would mean we would have to unwrap them both. So my options at this point are to hand it to a person that is gowned and gloved, or I could do what's called flipping it on their sterile field. And you have to be kind of careful with that because you want to stand about a foot away. This is all clumped up here. And I don't know really if I touched it or it touched me, so I don't want it to touch my table. So without touching this product, I'm going to reach here and I'm going to give a little toss. That's the way we could flip it. Now our other option would have been to unwrap the second wrapper, right? And so I would do the same method. I'm going to pull the top layer away from me because I am not sterile. And I'm going to tuck. And because my left side is first, I always put it in my right hand and I pull this way. And I'm going to tell you why now. Now when I have to unwrap this one, I switch hands. But I'll show you if I didn't. If I didn't, I would have to come around like this and do this, right? And look at where that metal is. It runs the risk of touching me. So that's why I always switch hands. I'm gonna grab this corner now, come back, and then my last is here. Now, it's kinda clumped here, you gotta be real careful with this. You could pull this back a little bit, tuck it again. I can see the indicator now. Now, this indicator obviously has not changed because we did not put it through the autoclave. But I would hope that that had turned to black, because that's what it tells me. And now I have another option. I could flip this onto a sterile field, or my surge tech could take it from me, correct? What would you do if you didn't have an indicator in there?
You wouldn't use it.
Right, you can't use it. What if your indicator is flipped upside down?
You can try to flip it back, but otherwise.
But you kinda gotta be careful with that, because what if you flip it so much that it hits my shirt and bounces back on the table? Now I've contaminated the table. So you can maybe wiggle a little and hope that you can do that. And it might be best then that the surge tech take it from you, because then if it has not turned and they grab it without putting it on the table, what would be contaminated?
Just their gloves.
Just their gloves, right. The minute they put it on the table, then the table's contaminated besides their gloves. So, so there you have it. That's how to wrap. Now, if you were gonna do an instrument, remember the ratchets have to be open. They don't have to be like this, but you just have to have them open in the product. So let's just do a once open, because it's the similar concept. Put it at a diamond shaped. Make sure your instrument is clean. Ratchets are open. Lay it in here. Lay your indicator strip that is for steam, because I'm going to use steam and it's not turned. Just lay it in there like that. And do the same thing. Come up, I fold this back like this. I like to do this. Maybe the people in the instrument room are probably a little nicer at doing this. And you're going to have to do a little roll with this too. Some people like to fold it back, make it real neat. And now I'm going to put the indicator tape, which would be steam, on here. And I'm going to label it on the steam. Or I'm going to use the tongue blade that has a label on it. And so this is a once open. Now if this is a once open, it is no different than two wrappers. I'm checking for the same thing. I'm checking for moisture to see if it's wet. I feel if it's wet, any stains. I'm looking for holes or tears and any grease, dirt. Checking for expiration date if my hospital has it. And I know that this wrapped a few times, right? So I'm going to grab my corner and I'm going to let it unfold a little. Now I'm going to tuck. And you see how those wings open up? Now what you got to be careful of is that if that wing touched me and now it bounces back and touches the instrument is contaminated. That's the deal with the blue wrappers. They have a lot of memory and they spring open. And so I'm still going to tuck. Even though it's sprung open, I'm still going to tuck. And we're going to be looking for our indicator. Once again, I can flip it onto the table or I could hand it to my surge tech. The advantage to two wraps sometimes are what? Who can tell me the advantage?
If it's ripped, you can still use it because the
Possibly.
inside could not
Possibly.
be ripped.
Another advantage when we use two wrappers is if there were multiple items, I could then give them to my surge tech so that they didn't fall all over the place. And then my surge tech on the field could open them up and they would not fall off the floor, so, or off the table onto the floor. So, any questions? No? Got it? Okay.